There's different options to improve or manage mental health, and this one involves plants. I chose this topic because it's accessible form of therapy, and according to my research, I'll be able to tell you history, what it is, and just overall information on it. Horticultural therapy or plant therapy serves as an intervention that promotes physical and psychological well-being and rehab for many individuals. One of the first documented use of horticultural therapy happened in Egypt, where physicians recommended walks in the palace gardens for royalty who were mentally disturbed. Later, this was just the beginnings of it, but this was later recognized as a treatment for people with mental illness. Through setting goals and following them, people with mental illness received structure, and this was the beginnings of the treatment. In the late 1800s, it was tested widespread on World War II patients, providing distractions for long-term and becoming a part of rehabilitation as a result of the mass usage. The patients shown less signs of stress during the daily routine. One of the reasons that they showed less signs of stress during this routine was because they had the association with plants and the break time as positive reinforcement. Now, because the materials are readily available, it's cost efficient. The goals created to follow with the therapy can be group work or in a natural setting, or specialized to the individual with the intention to improve cognitive issues. In working with patients with dementia, the sensory stimulation brings memories through tactile work. With the psychological responses, according to Kaplan, being away or a sense of escape allows for a higher chance of thinking of other things. So people who are suffering with PTSD, for example, as a result of World War II, were able to process their daily routines easier after receiving this kind of therapy. The extent focuses on the size of the plant or location being significant enough to bring the results. So whatever setting is being conducted in has to fit the structure. There's different therapy options to improve or manage mental health entirely, but this one slowly began building historically through many trials and practices. Another one of the options with the therapy is fascination. As therapeutic actions do not require conscious thought to follow through, it promotes a healthy recovery from daily tasks, require directed attention, and this takes away the attention from stressful activities that would be happening daily. Anything that meets this requirements can be walking in a park or gardening with group set goals. Even views from windows impact mental health. Inmates who had views of farmlands in sight had less sick reports than facilities that did not have views. HT allows for a pause in mental processes. Yes. The views of nature alone can lower blood pressure and muscle tension. Another part of HT has a psychological impact with a communal space, because the shared actions within a group quickly involve building a community, as well as labor involved, which can strengthen the physical body through routine. Things that follow the distinction of community are shared values, interests, and overall unity. This association can become synonymous with the practice and lead to more distinct choices. In other words, the patients of horticultural therapy or HT are getting tools to use and allow them to better cope with their issues. Applying these learned tools to everyday life will show an innate difference. Subjectively, HT builds through routines and cycles, allowing the tools learned to be thoroughly applied in regular life. And that's why I believe HT wrong speech. That's why HT serves as an intervention that promotes physical, psychological well-being through rehabilitation for individuals with varying conditions, including mental health disorders, development disabilities, and chronic illnesses.